Talk to us a little bit about those basic supplements, vitamins, and nutrients that you think are kind of critical every day to support immune function.
Sure. So the number one supplement that I would tell you the majority of people need is vitamin D.
Yep.
And vitamin D is this incredible hormone that upregulates both arms of your immune system, the adaptive um, immune system, which is your T cells and your B cells, um, and also the non-specific immune system. So if and making sure that you know what your vitamin D level is. And the problem is that we weren't trained in medical school or residency stating, hey, you need to be at this particular level. And there's, big discrepancies when you look at the ranges. The ranges aren't optimal levels. The ranges are the ranges that they find in people. So when you look at a lab range, it could be anywhere from 35 to probably 70. And you really, if you look at clinical studies, you want to be around 60 or higher. And that's based on studies, for instance, a vitamin D level of 35 versus a vitamin D level of 60. There was a study that looked at breast cancer in women, and there was a 40% reduction at the higher level. So to me, that tells me that's more of an optimal level to be at that 60 range. So it's an incredible anti-inflammatory. It's an incredible immune stimulator. It helps with brain function, heart function. So one of the best things that you can do is make sure that you're taking vitamin D. Most adults on the low end of about 2,000 IUs to about 10,000 IUs. I'd say the majority of my patients are on about 5,000. And I combine vitamin D with vitamin K2, and there's a reason. Vitamin D helps your body absorb calcium, so you want to make sure that your body doesn't just put calcium anywhere, especially in the heart arteries or valves. So vitamin K2 basically tells the body store the calcium in the bones. And there's studies with vitamin K2 in osteopenia and osteoporosis. So you can utilize vitamin K2 specifically to port that calcium in the place that we need it, which is to keep our bones nice and strong. The second nutrient that I think is incredible, and initially I didn't, it's not a very, what I call sexy nutrient, is zinc. Zinc is used for our bodies to kill viruses, bacteria, and it's very, very important. And when I started looking at clinical studies with zinc, I was really surprised at the benefits of zinc. And then also when I started looking at zinc levels in my patients, I was like, wow, this is a nutrient that's pretty depleted in a lot of people. And I looked at my zinc level over 20 years ago, and I remember I'm like, man, I was not, at that time, I was pretty much eating very, very well, and my levels were low. And I'm like, how can I have low levels? I mean, with everything that I eat, the variety of everything that I eat. So, just because you eat well doesn't mean that you don't have nutrient depletions. And I would tell you that most people have nutrient depletions, and optimal levels are important to reach. Understanding what those levels are and then supplementing appropriately is the route to go.
What about good old fashioned vitamin C?
Yeah, so vitamin C, I do like. I think vitamin C's got great health benefits across the board. I prefer to use vitamin C not on a daily basis because you get a lot of times if you're eating, a diet that's full of colorful fruits and vegetables, you're getting plenty of vitamin C, right? So do you need to take any extra? Too much vitamin C can increase your risk for kidney stones. So, living in the kidney belt with tea, not the best combination to say take vitamin C every day. I think when you're sick, boosting it, I think is a good thing. But as a preventative, yeah, probably not the thing that I'm going to want to bump up my immune cells for, right? There's some mushroom extracts, the beta-1,3-glucan, which is in some of these hybrid mushrooms, really good stimulator of like natural killer cells. It's a regimen that I do recommend for some of my patients that are more prone to getting sick. The kicker is understanding why the immune system's suppressed, right? Is it because they're not sleeping? Is it because of medications and so on and so forth that they're on? So it's really understanding causes of why someone's immune system is suppressed. But vitamin D, hands down, number one thing I'd recommend everyone to be on. Zinc, making sure your zinc levels are good. Understanding those nutrient levels are important for sure.